Hey, this is Dr. C. Thank you for joining me today. We're going to have a little different topic today. I feel festive, so a little different topic. But unfortunately, it's one that is ignored by many of the seniors, and that is sex education for seniors. Yes, for seniors. We need to know just as much, if not more, about sex than what is taught in the schools to the kids. Now, I don't know what place the Shrewsbury school system goes ahead and purchases the material for sex education in their schools. I don't know. But it's an entirely different topic than it is with seniors. Although the anatomy is the same, and I think we need to learn a little bit more about it. Now, what do I know about it? Well, that's what I always ask myself. What do I know about it? You look at my history and all. I went to a Catholic grammar school run by the French nuns. The boys lined up in one aisle, the girls in the other. Never mixed. The boys entered into one door, the girls entered into the other. Whenever there was any type of a quiz that required, say we wanted a spelling bee or something, the boys were on one side, the girls were on the other. It was always separated. And that line was drawn, and if you crossed the line, whack with the ruler over the back of the hand. That's how we learned our sex education. There was none in the schools back then. So, at any rate, what did we have over the years now? Well, we had that wonderful Kinsey report. I don't know if many of you probably remember that, the Kinsey report. Well, that was back in 1948, and that was a result of a number of interviews of couples. So there was no actual sexual stuff involved except the questions and answers from the interviews. But that was a big deal, Kinsey report. And then we had another one right after that, the Masters and Johnson. And they had their human sexual response published in 1966. And that was a result of a number of laboratory studies of couples. They did 360 some odd couples. So that was a direct result of that. It did shed some light on it, but nobody really dealt with the seniors with any of this. Okay. Dr. Ruth, you remember Dr. Ruth Wertheimer, she's the one that dealt with the seniors too, dealt any age. She was a lot of fun to listen to, and a very intelligent lady. It's a shame she passed away, but I guess we all have to go sometimes. But at any rate, seniors, no question, still have sex. And any studies that have been done, even though they're all maybe slipshod type studies, show that roughly 40 or so percent over 65 are still having regular sex. 40%, not bad. And when you consider the fact that the aging of the world, basically, the aging factor, we're increasing in numbers. We're going to be 20% of the population very soon, if not right now. 20% in the United States. Seniors. So we're not just talking to a few people. We're talking to millions. So we got to consider that. I needed to break up the topic a little bit, and we'll focus first on the women and then on the men. And what a better way to start than with basic anatomy. I'm going to have an illustration put on the screen of the, first of all, the female external anatomy, and we'll go from there. We'll go from there. Much of it you know already, because this is the same as what you may have learned in school. If you had a sex ed course in school, you certainly didn't get it from home. You certainly didn't get it from home. So that's a definite. So let's talk a little bit about the anatomy. First of all, the external female anatomy, when you look at it first, right at the top, the most superior thing up there, is the clitoris. Now the clitoris itself, you only see a little bean-shaped thing at the top. And that is sort of the homologous to the male penis. So, okay, that's there, and it's got a little hood that comes over it and all. That clitoris isn't just that little bean. That's just the equivalent of the tip of the male penis. It's just the tip. A lot of sensory nerves. They estimate roughly 8 to 10,000 sensory nerves right around that little bean. But it extends then right down along the shaft of the, or down the bean to the sides of the vagina. So that first third of the vagina has a lot of nerve endings as well. So it's the most sensitive part of the vagina. It extends then like a Y underneath the labia all the way down around the tip of the vagina, the posterior part, the bottom part. And that still extends down and connects to the area of the pelvis. So, okay, what is the purpose of all these things in that area? Well, first of all, we mentioned we got the bean at the top with a very sensory nerve endings on it. Then, as it comes down and all, you have the vaginal area. Now, that vaginal area secretes a vaginal lubricant, which is great. I mean, you need a lubricant in there. So that is missing, however, in the seniors. That lubricant goes down in volume as the thickness of the vaginal wall thins out. So that can actually cause, during intercourse and all, it can cause rips and tears and pain. Pain especially because of the lack of lubricant. Okay, so as we come down, you have the labia now, the labia. Now, most of the time that labia just expands a little bit, and that clitoral extension coming down right under the labia, right under there, that has the ability to expand when it's aroused. It can expand twice at the thickness as it gets aroused. And so it is an interesting phenomenon when that happens. So of course, all of these things have a name to them, and I don't know if you get anything out of listening to the names of all these things, but just conceive of it, that these things come down right under the labia and all the way down and around. Okay, so that's the external stuff that you see. Of course, that just deals with vaginal arousal, not with anal arousal. I'm not going to dwell on anal stimulation or oral stimulation. This is purely genital that we're going to deal with. Okay, so let's continue from there. As we age, it's not just the thickness of the vaginal tissue on the inside that thins out and causes pain, but that dryness makes it very susceptible to get infections. So increased number of infections as a result of that. Decreased amounts of bacteria, that leads to a problem then with the infections as well. So we need to think about that. So dryness is a big problem for women, pain with intercourse, and then there's that pelvic wall. That's the thing underneath that's holding everything up. That stretches out with childbirth and with age, and need to strengthen that pelvic wall. That's the purpose of the Kegel exercises. But we're not taught how to do Kegel exercises properly. They tell you, well, just try to hold everything in, squeeze it. Well, you need to squeeze each individual area. We need to squeeze around the urethra, which is the opening to the bladder, because loss of a little bit of liquid from the bladder, it's called squirting during intercourse. If you squirt a little bit of that clear urine out, squirting, you don't want that to happen. So at any rate, you want to squeeze that one first, squeeze the vaginal opening, and then squeeze around the anal opening. So all three areas, and you want to control each area. So squeeze 1, 2, 3, and hold it for 3 seconds, and then relax. And you do that, 3 seconds, relax. Do that at least 10 times, 3 times a day, even more if you can. You got to do them properly to get the most out of those Kegel exercises. Okay, let's go from there. There are a lot of problems that happen as a result of medications that you may be on. It could be medications that you take as a supplement, for example. Don't bother with supplements. They're a waste of money, a waste of time. Please don't waste your money on supplements. You don't need most of them anyway. But we do take meds that interfere with arousal and with intercourse or with your genital area. And some of them may be diuretics that make you pee more often, chemotherapy, which irritates the heck out of it, antidepressants, which relax it down there and really don't do a heck of a lot else, opioids if you happen to be on them, marijuana. All these things interfere with the genitals in the female. Okay, so and I'm not even talking yet about the emotional aspect. So remember, there's a lot more females at our age now than males, and that's because we happen to die a little younger than the women do. A lot of people get divorced, a lot of people. So there's certainly a lot more women than men. Okay, let's go on from there. We talked about trying to improve on all of those aspects of the problems that women could have having arousal and all. Well, let's deal number one with dryness. A lot of lubricants on the market. And the lubricants themselves can be water soluble, they can be oil soluble. There may be silicone-based lubricants as well. Some of them put a little bit of odor to them, using essential oils, for example. So there's loads of different lubricants out there. Some people like to warm them a little so it feels a little more comfortable when they use the lubricant. Some people try to get it done through the medical department. Well, what can you do about dryness and all? Well, you can use a laser. You can use a laser which will stimulate collagen growth and thicken the tissues just a little bit. Maybe even give you a little more natural lubricant. So that's a good thing, using that laser. But it's not cheap, obviously. Not cheap at all. And so I generally don't recommend that you rush to get get the laser treatment. You can use the lubricants, as I said, which are generally pretty good. Okay, why is it important for you to be very careful? Just like we tell the kids in school, please protect yourself from sex so they don't get pregnant. But not just for pregnancy, because we're not worried about pregnancy at our age. We're worried about sexually transmitted diseases, STDs. It's going up. Not dramatically, but it's definitely going up. I'm going to give you a little thing about sexually transmitted diseases, and there's a lot of them. It isn't just syphilis. Syphilis used to be a big deal until the penicillin shots came, so that people could recognize a chancre, which is a painless ulcer that can occur on the labia. And you get it treated with this relatively painful shot in your butt. But at any rate, it's due to a bacteria, Treponema pallidum. And it comes in 3 stages. First, that painless ulcer. If you ignore it, don't get it treated. The second stage then is a rash, a little papular rash all over your body. If you ignore that, then it's beginning to hit the organs. Some of the major ones are in the brain and in the valves of the heart. Not a good thing to have. Aortic insufficiency is a terrible, terrible disease to get from syphilis. Not that getting it in your brain is any better, but so that's syphilis. You get gonorrhea. That's going up even more now in numbers. That's due to a bacteria too, Neisseria. Over 55s went up roughly 300% from the number only 10 years ago. And I'm talking about people now who are over 65. Last year in the United States, there were over 600,000 cases, at least reported, of gonorrhea. And that is treated as well, usually, with ceftriaxone. And, okay, the third one is chlamydia. Chlamydia used to be known as lymphogranulomas. What you get in the groin area, you get a swelling, gets into the lymph nodes, big lymph nodes down there. They call them bulbos, but that's due to chlamydia, which is the third largest number of sexually transmitted diseases that we can get. That's easily treated too. Doxycycline or azithromycin usually gets treated. There's also a number of other lesser but still significant sexually transmitted diseases. The one that we know about the most are viruses, like HIV, for example. If you get AIDS from HIV, that's a big deal. You have to have retroviral therapy with that, which does pretty well, but you're never totally cured of that AIDS. And the AIDS kills a lot of the immune cells that are fighting the infection, the natural cells that fight them and all. It's still a fair number of AIDS that occurs every year. Roughly in the United States, about 30,000 cases last year of AIDS, new cases. Another virus is herpes. There's herpes oral, herpes genital as well. And so the herpes simplex, virus 1 oral, virus 2 genital. No cure for that yet either. People who get cold sores, those are herpes virus 1. You can get cold sores down in the vaginal area. They're painful as opposed to a chancre, which is an ulcer that is not painful. Okay, so that is the herpes. And there's what you do for herpes. There are antiviral agents that we can take, and that does ameliorate the present outburst, you might say, but it can come back again. And so that's the problem with the herpes infections. We also can get a specific urethritis, just an irritation of the urethra. That's usually due to a mycoplasmosis. Again, it's treatable. It is treatable. Women can also get trichomoniasis. So that usually you can identify just from the odor. It's a greenish, bluish material that comes out, foamy, little bubbles in it, and it stinks. It literally stinks. The stinkiest of all of the STDs, that can be treated as well. So, and for trichomonas, what do we use? We use Flagyl. It's a very common antibiotic that we use. We can also get Mycoplasma genitalia, and we generally, that's in the tubes up higher. That also can be treated with azithromycin as well. We can get HPV. Remember, the kids now are getting injections to prevent HPV. It can be either in the form of a wart, and the warts are very contagious by contact. And so we have to be very careful about the warts. And when you get older, there's an increased incidence of cervical cancer. Not a good thing. So that's with the HPV as well. And then there are other alternate things, not a virus, not a bacteria. You can get what are we would call crabs, which are pubic lice. You can see they're pretty small, but if you look carefully, you can usually see them. Pediculosis. You can get it in your hair, for example. The kids get checked in school for their hair and all, and they're right at the root of the hair. Well, you can get them down here too. So that is the lice, the pubic lice. We treat that with permethrin, generally. Okay, and the one other one too is scabies. Those are not lice; those are mites that can, and they can cause an intense itch. And usually we look in the inner finger area and all. You can get them in intertriginous areas of your body and itch like crazy. And that is very contagious by contact as well. All these are sexually transmitted diseases. How can you prevent it? You can prevent it because you have to use some prevention method. You can use a condom. Yes, a condom. Now, a condom back many decades ago when I was a kid, we used to carry a little condom in our pocket for a while and hope that someday we might need it, you know. But nowadays, there's many different varieties, different sizes of condoms, different colors. They may be treated with some material, a lubricant, so you don't even have to worry about using a lubricant with the condom. They may even use spermicidal gel, which we don't really need to use at our age because some people are sensitive to that stuff. So it can come ribbed. It can come with little dots on it. No, in other words, different shapes and sizes of the condoms. The most important feature of the condom, which you may think is the length of the condom, the number of millimeters that you can get, that's a misnomer that the bigger the penis, the more the pleasure. Total misnomer. Remember, most of the sensation is towards the outside part of the vagina. Now, also, I failed to tell you the one important thing, that there is what's called a G spot. Now, that G spot's, it's called a G based on the name Grafenberg. That was a Dr. Grafenberg who first identified that. And it's on the top of the vagina, roughly about 2 inches in. And so if you want to stimulate the G spot, you can use a finger and with a little come hither type of thing going in, that'll stimulate the G-spot. Okay, that's fine. I forgot that with the anatomy. I'm getting older. Oh, God, it's terrible. Okay, we were talking about condoms. So it comes in different lengths, starting roughly about 50 they call them in millimeters, 50 millimeters or more. Many different sizes. Look at the number of sizes that they have. Different lengths and different girth. Now, the girth is not the same as the circumference around it. Circumference is just for a circle. Now, the girth, what we can do, you need to measure the girth to get the correct size condom. And so it comes in different girths. You need to measure your own, right around the middle where the biggest part of the penis is, erect, the erect penis is. And so measure that and get the appropriate length and girth of the condom. You can buy all sorts of different types. You can come, most of them are latex, and they come ultra thin as well as a thicker latex. Now, the thicker latex are supposed to be resistant to breaking and all. Ultra thin don't break often, but it can. The thing that is the most dangerous is it doesn't fit well. So you need to measure your penis erect to get the appropriate size and length of the condom. You've got to prevent sexually transmitted diseases. That's the main reason in a senior. They can't get pregnant. You've got to protect and protect yourself as well. Okay, so I'm harping on that too darn much, I guess. But so you're getting the appropriate one, and you're gonna. I like to heat the lubricant if I use it. It's much more comfortable. Much more comfortable. Watch out for two things. Number one, if you get an oil-based lubricant, it can stain the sheets. Not good. Not good to stain the sheets. Okay. Number two, they have what's called natural, not latex, latex-free, not polyurethane, not like the alternative to latex, but these are natural. They're lambskin. Problem with lambskin, it can protect you from getting pregnant, but it can't protect you from STDs. So if you like a lambskin, for God's sakes, don't use it anymore, okay? Don't carry them around in your damn wallet. Just keep them in a dry, cool place until you need them. Now, women can use a condom as well. They're obviously much bigger, and you can unroll them in there, and they serve the purpose. You can also use a diaphragm. I don't think it's used as much anymore, diaphragm, but there's a cervical cap you can put on. Those things get dislodged quite often and not as reliable as the male condom. Okay, so that in a nutshell, I guess, is what I wanted to talk about with the women. And so let's see if I got anything else. I did talk about that. I talked about that. No, I think we covered them pretty well. So this is Dr. C. I want you to stand by. Come to session 2 for the males as well. Thank you.